All right, great. Can you all see slide one? It says Unite Us at the top. Amazing. Well, thanks everybody. Good morning, and thank you, Sarah. Yeah, we are excited to be here and talk mostly about a new resource that was released in New Hampshire about a week ago. So, a new way for residents to kind of connect themselves to care, but also with the help of Unite Us and with what we call a Connect Navigator. But I will just kick us off with a little bit of intro about Unite Us and also introduce myself because I think I've met some of you on the call, but not everybody. But good morning. Thank you again. My name is Sonia. From Unite Us. So, Unite Us, if you haven't heard about us yet, we are the closed loop referral technology that powers, that connects with, that partners with the New Hampshire Care Connections Project. I work really closely with DHHS, with the state, with Granite United Way on the project, and really excited to be here again to talk about some of the resources available on the platform and how to fill kind of some of these gaps or help fill some of these gaps now in the future that we're seeing. So Unite Us, again, is the closed loop referral system or the CLR partner on the project. So that empowers our partners to send and receive social care needs referrals to each other via the platform for over 150 different service types. You can track outcomes, you can improve care coordination across the state and the network. That is the goal. And in addition to the ability to send and receive referrals, we also support the New Hampshire Public Resources Directory and offer some other ways to connect residents with care, including what we call the assistance request form, which I'll talk about today. Our shared goal and really the mission of the project is to connect patients with the right service at the right time so that no wrong door approach, enhanced communication between providers, so between all of you, and also directly with clients, patients, residents, reduce inefficiencies, and really focus on prevention by addressing health related social needs and whole person care. As for what I do at Unite Us, I am on the customer success team. So I work with partners with users kind of from this stage, so from engagement, as we call it, all the way to when you're live, and then for the rest of the time that you're with Unite Us. So I'm kind of your go-to person. I would say I'm a little bit technical, but mostly kind of here to interface among all of the many people that you would talk with at Unite Us to make sure you have what you need. Um, Brittany, do you want to say hi if you're on? Sorry, I
Hi,
don't want to put you on the
yeah.
spot.
No, it's great. Yeah, hi, good morning. I know all or most of you, so yeah, thank you for having me this morning. I'm really excited about the ARF, the assistance request form.
The
Um,
ARF.
the ARF, yeah, as we call it, just because I know that they're really ready over at 211 to play that navigation role, and it's just going to be such a great tool, I think, for people, especially in food access. So thanks for having me.
Awesome. Thank you. So yes, we can talk about the ARF first. We finally call it the ARF, and it makes us think of a dog, Caleb's dog. So ARF, Assistance Request Form. So this connects residents to services on the platform in New Hampshire via what we fondly call a Connect Navigator. So that's an actual person who refers residents via the Unitas platform to services on their behalf. So navigators are community health workers, volunteers, social workers who link people to services and resources in the community. So let's see if I can actually go to the forum if it'll let me. Can everyone see now a website instead of my presentation? Okay, awesome. So you would fill out, and also if you're with someone, you can fill this out with them sitting there with you. But you fill out this pretty quick form here. Scroll slowly down. It's pretty short as far as, what they're seeking. Fill out a quick request for services. You can fill out the consent. You can view the consent here and submit. All of this is free. All of the information is confidential. There's no cost for the service. So the resident would fill out all of the information there. The form would be sent to our wonderful navigator, who right now is Soila, person called Soila. Brittany might know her personally. I have never met her. I've emailed with her. She reviews the information and creates a referral through the platform and finds a suitable provider. or community-based organization to send that information to. And we were just talking about supply and demand lines, not kind of knowing what's available when. This, in theory, kind of helps solve that. So you know, okay, this, New Hampshire Food Bank it has exactly what they need available right now. You can communicate with them through the platform, chat with my friend Brittany who works there and say, hi, I'm going to send Sonia there. She needs to come over at 9 a.m. tomorrow. Will you guys be there? Do you have the infant supplies she needs? Yes, we will be there. Amazing. Send her over. So this allows you to help them on your behalf and is a new kind of thing released again just about a week ago. Is there anything you'd add, Brittany?
Coming off mute.
Hmm.
I no, just sort of the difference between this and using Unite Us as the closed loop referral platform. I just want to, make that really clear for people because they're kind of two different options. And this one is really
Hmm.
great if you are, for instance, you were just talking about, I don't remember your name, but you said that there was a really long line at your
Antonio, I
pantry.
think. Yeah.
Antonio, right? Yeah, there's a really long line at your pantry this weekend, right? Well, you could have had these rack cards out. And instead of you taking the time or one of your volunteers to go and fill out a referral through Unitas as a partner that way, instead they could just take these rat cards and go home and fill out this request form. And Soila over at 211 would kind of handle all of the follow-up of the sender of that referral. So, the advantage there is that it's easier for you guys. The disadvantage is that then you don't capture that like case management data on your end. But so that's kind of the two major differences between the two things, the ARF or joining closed loop referral.
Awesome. Thank you. Yeah. So it does take usually fewer than 2 business days. Depends on when, if you do this on a Friday, it will take 2 business days. So it does not work Saturdays and Sundays. But we say within 48 hours, the resident will receive information back and kind of just, hey, this was submitted on your behalf. Here's the information. Here's where you go to get help. Are there any questions on this? I can kind of see the chat, but if someone could help me, if there are questions in the chat, that would be awesome.
Not seeing any questions in the chat.
Okay, amazing. Thank you. So we'll also quickly review the public resource directory. So this is another way that residents cannot be directly connected with care, but can browse all of the over 10,000 local social care programs available across New Hampshire. So you can search by location, by need, you can see a screenshot there on the right, and there's a link there too. I think we'll share out these slides. And also, you're saying Jessica nicely created a wonderful flyer with all of these via QR code that you can use to access all of these resources. But this is kind of one step back from that ARF that you can see all of the resources near you by location in one spot. And finally, this is a pretty important part of the ARF. In order to be connected with all of these wonderful places, they do have to be on platform. So if you are not yet on the Unitas platform and you would like to be findable through the ARF, through the assistant request form, you can fill out that form or you can just email us. I'll put my info in the chat and we can tell you more about what that looks like and how you can either be on there, just to receive referrals from Soila, from the Connect Navigator, or you can even be on the platform to start doing referrals yourself, sending and receiving, so that, like Brittany was saying, you get that other level, that one step up where you can track, you can see what's happening, you can chat with other providers, other community-based organizations in the state, and just really get that other level of care for your residents. So to wrap us up, here are some handy links that we'll send out. I'm a resident who wants to be connected to help through the Connect Navigator. I want to search for resources on my own, find resources there through the PRD or the Public Resource Directory. Or finally, I am an organization or a provider who wants to update my Unite Us profile. Click there and we will be in touch to help you do that. Any questions, anything I'm missing, Brittany, on the why, the how, the next?
I think this is awesome. That makes it really simple. And you have it all right, Sonia, in terms of what the value is, especially for the Manchester, food access. You've heard me speak a lot about getting on for that third thing, update your profile, get on so that you can be a resource and also send and receive referrals, but it doesn't have to be that heavy of a lift either. So just again, highlighting that people can do it on their own by just scanning a QR code or looking for resources, or that you can connect them to a navigator outside of your organization, I think is really powerful. So great job, Sonia. Thanks.
Thanks, team. Thanks again, everybody. Thanks, Sarah.